My name is Christiana Abraham Jeremiah. I'm a 100-level nursing student of JPTS Institute of Management, Science and Technology in collaboration with South American University, USA, Global Wealth University, Togo, and Pan American University, California. I'm here to briefly talk about the social-cultural factors influencing the nutritional status of children below 5 years in various communities. First, I will start by defining what nutrition is all about. Nutrition is the process of taking in food and using it for growth, metabolism, and repair. Child nutrition plays a key role in infants and child health or death. Young children and pregnant women are nutritionally the most vulnerable groups, especially in developing countries of the world. And yet, relatively little is done to achieve their special nutritional needs. The importance of nutrition in childhood for both immediate health and health in later life is a topic that has aroused a considerable interest and argument over the past 15 to 20 years. The depth of interest are new, but the concept that the way a child feeds has a long-term effect or consequences which are not new. Importance. In developed countries and many traditional societies today, early feeding has been considered a determinant of later characters as much as later growth and health. Correct nutrition ensures healthier children who grow into more productive adults, while poor nutrition, on the other hand, leads to malnutrition. On the other hand, malnutrition continues to be a significant public health and development concern around the world. Malnutrition is a condition that results from the taking of inadequate diets in which certain nutrients are lacking in excess or in the wrong proportion. Factors that influence the nutritional status of children are many and varied. These factors include inadequate diet intake, poor household, food security disease such as diarrhea, infection, etc., inadequate maternal and child care, unhealthy environment, lack of education and nutritional information. To mention but a few, all these in turn lead to malnutrition. Children malnourishment were from their mothers, and formal education, which was about 48.7% from mothers, and primary education, 15.9%, had secondary and tertiary education respectively. There was significant difference, which is 0.05, in relationship between family structures influence, social economic status influence, maternal education influence, and nutritional status of children. In conclusion, all the variables, family structures, social economic status, certain religious and cultural practices were all perceived to have a negative influence on the nutritional status of children. Maternal education also have a strong influence on the nutritional status of children, as educated mothers had less number of children malnourished. Recommendation, which is the healthcare personnel should educate mothers on factors that lead to poor nutritional status. Women empowerment through education should be encouraged as it promises improved family finances, better food security, and better childhood nutrition. This study was carried out to assess the social-cultural factors influencing the nutritional status of children below 5 years in selected rural communities in Abuja. The objectives of this study were determined in the influencing of family structure, social economic status of the family, maternal education and the nutritional status of the children, and to identify the religious and cultural practice that influence the nutritional status of children. A simple random sampling technique was used to set 5 communities from the LGA, which is the local government area, from the study, and snowball non-probability sampling techniques that was used to select the subject from the study. The target population was unknown. A simple size of 384 was determined using Golden formula. For infinite population, self-development questions with 4-point modified Likert scales was used. In conclusion, I think the public health care personnel should make adequate education for mothers on how to prevent their children from having malnutrition during childbirth. Also,